Friends, now we are going to see about suprahyoid muscles. So suprahyoid muscles comprises of 5 muscles. In this video we are going to see about these muscles and description of each muscles. So suprahyoid muscles includes digastric, stylohyoid, mylohyoid, geniohyoid and hyoglossous. So these are arranged in 4 layers. The first layer includes digastric and the second layer consists of mylohyoid and the first layer consists of digastric and stylohyoid and the second layer consists of mylohyoid and the third layer consists of geniohyoid and hyoglossous and the fourth layer formed by genioglossus muscle. So these are arranged in 4 layers. In this image we easily appreciate the suprahyoid muscles. So this is the anterior belly of digastric and this is the posterior belly of digastric and styloid to hyoid bone. This is stylohyoid. Then this is the mylohyoid line to hyoid bone and this is geniohyoid. So genial tubercle to hyoid bone. So these are the significance of and the image of suprahyoid muscles. So in this video we are going to see about these muscles one by one. So first of all we are going to see about digastric muscle. It has 2 bellies which are united by an intermediate tendon. So its origin is from anterior belly from the digastric fossa and posterior belly from the mastoid notch of temporal bone. Then the anterior belly fiber runs downwards and backwards and for the fibers of posterior belly runs downwards and forwards. Then both the heads meet at the intermediate tendon. So which perforate the stylohyoid which is held by a fibrous pulley to the hyoid bone. Then we are going to see about the nerve supply. The anterior belly is supplied by nerve to mylohyoid and the posterior belly is supplied by facial nerve. The action of the digastric muscle is to depress the mandible, that is opening of mouth, and elevates the hyoid bone. Now we are going to see about the relations. So first of all we are going to see about its superficial relation. So superficial relation of digastric muscle, that is posterior belly of digastric muscle, is mastoid process with sternocleidomastoid, splenius capitis, longissimus capitis, stylohyoid, parotid gland and retromandibular vein, submandibular salivary gland and lymph nodes, angle of the mandible with medial pterygoid. So deep to the transverse process of atlas with the superior oblique, rectus capitis lateralis. Arteries include internal carotid, external carotid, lingual and facial, occipital. Vein includes internal jugular vein. Nerves include vagus, accessory, hypoglossal nerves, then hyoglossous muscle. Next, upper border is comprises of posterior auricular artery and the stylohyoid muscle, and the lower border is related to the occipital artery. So this is the image of digastric muscle. This is the anterior belly and this is the posterior belly which is united by an intermediate tendon. So next we are going to see about stylohyoid. So stylohyoid includes, it is a small muscle which lies on the upper border of posterior belly of digastric. So its origin is from styloid process. So the name itself signifies styloid to hyoid bone. So styloid process, that is posterior surface of styloid process. Here the fibers runs like a tendon which is perforated by the posterior belly of digastric muscle tendon and inserts at the junction of body and greater horn of hyoid bone. So it is supplied by facial nerve and its action is to pull the hyoid bone upwards and backwards, and also with other muscles it fixes the hyoid bone. So these are the action of stylohyoid muscle. So in this image we appreciate stylohyoid, that is styloid process to hyoid bone, that is junction of greater horn and hyoid bone, body of the hyoid bone. So this is stylohyoid. Next we are going to see about mylohyoid, which is a flat triangular muscle. The 2 mylohyoid muscle, that is right and left, joins to form the floor of the mouth. It is very important. Floor of mouth is formed by mylohyoid muscle. Okay, so this name itself signifies mylohyoid line to hyoid bone. So its origin is from mylohyoid line of the mandible. Then its fibers runs medially and slightly downwards, and the fibers inserted to the body of the hyoid bone. If it is posterior fibers, then the anterior and middle fibers inserts into the median raphe between the mandible and hyoid bone. The nerve which supplies the mylohyoid is nerve to mylohyoid, which acts to elevate the floor of the mouth and helps in depression of the mandible and elevation of hyoid bone. So these are the significance of mylohyoid. So in this image we clearly appreciate the mylohyoid. It's from mandible to hyoid. So mylohyoid line to hyoid bone. Then we are going to see about its relation, mainly superficial and deep relation. So superficially, anterior belly of digastric, superficial part of submandibular salivary gland, and mylohyoid nerves and vessels, submental branch of facial artery. These are superficial to the mylohyoid muscle, and deep to the mylohyoid muscle. Hyoglossus with its superficial relation, genioglossus with its superficial relation or deep to the mylohyoid muscle. These includes styloglossus, lingual nerve, submandibular ganglion, deep part of submandibular salivary gland, submandibular duct, hypoglossal nerve, along with sublingual salivary gland, lingual nerve, submandibular duct, lingual artery, and the hypoglossal nerve. So these are deep to the mylohyoid muscle. Next we are going to see about geniohyoid muscle. So from it is a short and narrow muscle lies above the medial part of mylohyoid muscle. In this image we clearly appreciate geniohyoid from the genial tubercle, that is inferior mental spine, to hyoid bone, that is anterior surface of body of hyoid bone. So here the fibers run backwards and downwards to for insertion. Then the nerve supply is C1 through the hypoglossal nerve, and its action is to elevate the hyoid bone and depress the mandible. Next we are going to see about the hyoglossus, that is hyoid bone to tongue. So it is an important muscle and it is a muscle of tongue. The whole length of the greater horn and lateral part of the body of hyoid bone is the origin for this muscle. This muscle originates from the hyoid bone, and then the fibers run upward and downward for the insertion. The insertion is at the side of tongue between the styloglossus and inferior longitudinal muscle of tongue. And then the nerve supply, hypoglossal nerve supplies this muscle, and its action is to depress the tongue and retracts the protruded tongue. So these are the action of hyoglossus. So its relation, that is superficially, styloglossus, lingual nerve, submandibular ganglion, deep part of submandibular gland, submandibular duct, hypoglossal nerve, veins, all are lie superficial to this muscle, and the deep structures include inferior longitudinal muscle, genioglossus, middle constrictor of pharynx, glossopharyngeal, stylohyoid ligament, and lingual artery. So the structures which passing deep to the posterior border of hyoglossus include glossopharyngeal nerve, stylohyoid ligament, and lingual artery. So these are the structures which passing deep to the posterior border of hyoglossus. So hope this video is useful for everyone. Thank you.